Wonderful. Thank you for taking some time out from your busyness and spending some time with me today. I really appreciate it.
Happy to do it.
And I just wanted to read you, I posted today that I was going to be interviewing you. And this woman posted, this book changed my life. I still refer to it all the time and tell people to buy it.
Oh, yay. Thank you.
You're
I appreciate that.
welcome. Yeah. And that's how I feel. I feel that that book changed my life, and my studying with you, going to Louisville and studying with you really made such a huge difference. So thank you for all the work that you do and have done. Yeah.
Yeah. No, it's such an honor to be able to help people. And
Right.
yeah, I feel really, really lucky to have come into massage therapy and have taken this journey into trigger point therapy.
Yeah, totally. So before we go any further, I want to take a moment to introduce you.
Okay.
So here we are. I'm in Asheville, North Carolina at FreeBody Trigger Point Therapy Massage Clinic. And I have the honor to be interviewing Amber Davies, who is the co-author of this incredible book, the Trigger Point Therapy Workbook, my worn copy of this book. This is the second edition. There's a third edition. Is that correct? That's the current edition is the third. Mm-hmm. And we will definitely drop a link to that that book in any descriptions that we use this for. And Amber is a certified trigger point therapist and got into trigger point work through her father, Claire Davies, who she co-authored the book with. And he had frozen shoulder, and my understanding is that he, through looking through the Travell books, figured out the places that he needed to work in to get rid of his frozen shoulder, and that he was able to do that, and then got so excited about it that he decided to make a book so he could help as many people as possible with pictures and diagrams, like here's how you can work on yourself. And Amber helped him to create that book and now has taken the reins. Claire has since passed, and Amber continues to do this work, helping people all over the world. How many languages is this book translated in at this point?
I'm not really sure, which is kind of a dumb answer. I think around 25.
Wow.
The publisher, it's published by New Harbinger Publications, and we have nothing to do with it. They periodically pop up and go, oh, there's a French edition. And sometimes they're supposed to send us copies, and sometimes they do, and sometimes that doesn't happen. So it's exciting. Yeah.
Super exciting. It's so wonderful because I feel like self-trigger point release work is such an extraordinarily empowering practice, a way that you can take the reins back from pain that is limiting one's life. And sometimes it can be really easy. Sometimes it's a really big puzzle. The body is complicated, but sometimes it can be really easy. And what I see in my clinic all the time is people really needlessly suffering from stuff that really could be pretty simple to address. Is that your experience as well?
Yes. And I see, I think because of our book, I see a lot of complicated stuff. More and more, my new clients are coming through Googling trigger points or myofascial release. And so and that didn't used to happen 20 years ago or 15 or even 10 years ago. People weren't searching for trigger point therapy. It was more common that they would come through the book or through a referral from somebody else. So it's, every once in a while I get somebody who has the book already, but for the most part, people are learning about trigger points online, on YouTube and on lots of websites. And so by the time they get to me, when they're looking for trigger point therapy, they're already doing self-applied massage, and they may not have known about our book until they read about it on my website. So I have to do a little bit of like, okay, let me tell you, I do know what I'm talking about.
Right.
And I hope I have the right answer for them, but sometimes things are complicated.
Yeah, sometimes they are. Sometimes they are. And your clinic is called New Day Myopain Center in Louisville, Kentucky. Is that correct? Okay,
Yep.
great.
Yep.
And are you still teaching? Because I came and I got so excited about the book and how it helped me heal my sciatica that I came and studied with you at perhaps your former space. I think you
Yep.
might have moved since then. So you're
Yep.
teaching classes for massage therapists and
I do have continuing education classes. My website's a little out of date, but I'm planning on workshops this year here in Louisville.
right.
I don't travel as much as I did in the past and will in the future. I taught a class in Denmark this year in July.
Fabulous.
In
Fabulous.
Copenhagen, and that was, that's the first time I've taught internationally, and I my kids are now old enough to travel with me or to be left at home, so yeah, more opportunities hopefully. But yeah, if you're looking for continuing education for massage therapists, I only offer CEs for massage therapists, but physical therapists, PT assistants, other people who are doing manual treatment, who have a license to touch and do manual treatment, do come and take the class. It's not really quite appropriate for personal trainers or athletic trainers.
Sure.
So
because it's hands-on, those continuing ed classes are hands-on other folks.
Yeah.
Right?
And it's it's within a massage setting. So I could build a class for personal trainers. It'd probably be good to have a personal trainer collaborator that I don't currently have, but I have had in the past for classes, because I know a lot of personal trainers are trigger pointing people now and teaching self-treatment, and which I think is great. I think everybody should be doing self-applied massage, and everybody should be treating trigger points. And trigger points are not the whole ball of wax for every kind of pain.
Totally.
It's a piece.
So then let's jump in then. So could you give me your description when someone says, well, what is a trigger point? What's your answer?
My answer is that, so my lay person answer, my easy answer is a trigger point is basically a knot in the muscle, and they happen where the motor nerve comes into the muscle to tell the muscle to do its job. So the nerve comes in and it dumps chemicals into the muscle to tell it to contract. And what happens is it gets to be this feedback loop of an energy crisis. And the muscle keeps basically saying, help, help, I need more. And the brain gets the message of, oh, you need more? All right, let me send more acetylcholine. Let me send more contract. And so it gets stuck in this loop of contraction. And the way to break that loop is to stop contracting the muscle long enough that the body can catch up and recreate this homeostasis. Or you have to have some kind of intervention to the muscle, including massage, dry needling, something that changes that loop of what's happening between the muscle and the nervous system.
Great answer. Great. And so one of the, why does that happen? Why do muscles get trigger points in the first place?
I think it's self-protective. One, I should also say, we don't know everything about trigger points. We know a whole lot more than we used to. There's lots of folks online still saying stuff like trigger points aren't real, it's all made up. And that's old news. We know for a fact by studies where they have gone in and sucked out the tissue and the fluid from an active trigger point versus a latent trigger point versus normal muscle tissue. We can tell that chemically that they're different. The tissue is different, and they're different chemical compounds. We can see them on color Doppler ultrasound, and we can see them on a special type of MRI within a research setting. So I think we know that trigger points exist. We know that trigger points cause pain and refer pain elsewhere. They shorten the muscle. They make these tight bands in the muscle. What a more appropriate question is, should we treat them? When should we treat them? And how should we treat them?
Great. Well, let's talk about that then. So should we treat them? When should we treat them? And how should we treat them?
Yeah. So I think we should treat them with a little asterisk next to that, right? So because trigger points can be this self-protective mechanism. So say, for example, one of the questions you emailed me earlier was, how do I know if my achy shoulder pain is from trigger points and muscles, or if it's from a torn tendon or an injury? Sorry about that. Sorry, I just had a notification come through. How do I know? First of all, if you have an acute injury, if you are falling down the steps and you grab the banister and you have a sudden searing, tearing pain in your shoulder, and you suddenly have a blob of tissue at your elbow or your shoulder that didn't used to be there, you might have torn your biceps. It might have rolled up your arm. So an acute injury, you need to go to the doctor. You need to see somebody to have that, to take a look at, see what's happened. Sure. It's more likely to just be muscle if it's accumulative. And the injury will cause trigger points. So maybe you've torn your bicep and you've had a repair, and you've gone through physical therapy, and you're still having aching shoulder pain, and you've got dysfunction, you don't have the full range of motion. Look for trigger points.
Sure. Yeah.
So it's trigger points are going to happen with any other condition that's going to affect the neuromusculoskeletal systems. So the question to ask is, what is the role of muscle in this situation? What's the role of muscle in this pain, in this injury? And what is the role of trigger points? If there were trigger points contributing to this pain, which muscles would I treat? Because the problem is not in the place that hurts. 85% of the time. I totally made up that number. Okay. That's Amber Davies' opinion. Okay. Not scientific. That's my clinical 20 years of working on other people, 25 years working on myself, 26 years working on myself. 85% of the time, the problem is not in the place that hurts.
Right.
So if you're rubbing it and you're going online to figure out how to help find the spot in your shoulder because you're not finding it, not fixing it, it's not here.
Right.
It's coming from somewhere else.
Right. Yeah. And they can be, the pain referral or sensation referral can be really far away from the site of the trigger point. It can be, that deep ache in the shoulder can come from infraspinatus on the shoulder blade, or there's even that trigger point in the soleus that can refer into the jaw. It can be really far away, which can make it really tricky, which is why your book is so valuable to people, because it gives them guidance. Like, if I'm feeling the pain here, this is where a trigger point might live that might be causing that pain.
Yes.
Yes. Great.
Yeah.
And so, so is every tender spot that we have in a muscle a trigger point?
No. And not every lump and bump in your body is a trigger point. I was talking to somebody yesterday who's been working on her trigger points for a while, and she finally realized that she was working on some lymph nodes, and she's got really excellent palpation skills. And a trigger point it's in the muscle itself, it's in the muscle tissue, and it just feels more dense there. If you can feel it when you're working on yourself, you're so distracted by the sensation, like how that hurts, that it overrides the sensation from your fingertips. You're not thinking about your fingertips as much as you're thinking about your pectoralis muscle and the owie spot that you're pressing on, right? So if you're looking, say I'm looking and I can feel my ribs and I can feel the muscle tissue, I might feel a band of taut muscle fiber, and I can search along that band and find something that's tender. And if I notice, especially if I'm doing this on somebody else, I'm going to notice that the muscle feels more dense there, but it does not feel like a bean. A trigger point does not feel like a bean or a pea or a pea-sized nodule. Dad used that term in the first book, and it's been the bane of my existence. And it feels more like partially cooked macaroni, like the tissue is just denser. Most importantly, you're looking for pain, for sensation that you can change. You press harder, it hurts worse. You lighten up, it hurts less. If you find a tender place and it goes from 0 pain to 10 out of 10, and you can't make it a 3 or 4 or 5, it's just nothing yucky. Get off of it. It does not want to be massaged, period. And it's probably not a trigger point. Or if it were, it's from a nerve that's being compressed and it's mad. So you listen to your own body. You want to make it feel what I call therapeutically delicious, a little bit painful, but you like it.
Right. Yeah. There's that like relief that it feels when you get the spot. It's like, oh, it's intense, but I love it. It feels like there's this kind of soothing in a way that happens. I like to tell people, I think trigger point work is ultimately the most relaxing massage that you can get, because it's actually really addressing tension in your body and those deeply held patterns that keep us kind of stuck and keep us in pain.
Because ideally you get off of the massage table with your body feeling different, the tension in your body. Wellness massage is good stuff where you're focused on just the experience of being in the moment and the relaxation. And, you know, because we all need the stress relief and the relaxation part. And sometimes that can be profound enough that it lets, you know, your nervous system really relax and your muscles relax, and you can get off the table with your shoulder feeling better and your low back feeling better. It can be very significant. I do problem solving massage because I want people to not only have the relaxation, but for their soft tissue and the tension in the soft tissue between the joints. I want it to change.
Yeah, absolutely. It's exactly what I say. You should feel different when you get off this table. Yeah, you should feel really different. And better, right?
Hopefully. Better, please.
right.
But I also want to know the truth. If they don't feel better, I want to know.
Exactly. Yes, exactly. Yeah. Because it's a puzzle, because no muscle works in isolation. Nothing is working in the body in a vacuum, right? So, and different pain referral can come from different sources, right? So that's not just one point that refers like into the SI joint or along the top rim of the pelvis. That could be coming from several different muscles if it's muscular. So we want to make sure that we're covering all the bases, like you said. So I'd like to talk a little bit more about self-trigger point release work and about that relationship with trigger points, in the sense that, so, you know, if I'm using your book or looking at stuff on YouTube and I have that classic trapezius headache that goes up the side of the neck and wraps around the side of the head and it aches. And so I open your book and I'm squeezing my upper trapezius and I find that point. A couple of questions are, how, you already answered, how hard do I squeeze, right? Delicious. It should feel deliciously exciting. And then also,
I feel like we could talk about that for an hour.
Oh my gosh, right?
Because, you know, I've been interviewed a couple of times. We wrote the best-selling book on this topic that and there are lots of other books, lots of other resources now that are getting lots of views. And I should have a bajillion videos. I just don't do videos, and nobody's sat on me and made me do it yet. So there's lots of other folks out there with lots of really great ideas, with lots of really great techniques. And I get frustrated when I go and I watch the videos online, because what I see most of the time is folks who are really abusing their muscles and who are pressing too hard, too long, and working too often on it. So, you know, they're laying on the floor with a lacrosse ball.
Right.
Let me give you an example. All right. I've taught thousands of people in person in workshops. Okay. And however many more, hundreds, thousands in my private practice working one-on-one. When I give people a choice between like a high bounce splitter ball and a tennis ball, a high bounce pinky, which is a foam ball, and a lacrosse ball, I have 4 balls this size. When I give them the choice of those 4 balls and put them against the wall with the ball, 5% of people want the lacrosse ball.
Yeah.
Okay. 20% want the soft, squishy foam ball. All right. So, and then, but you see online, all of these people laying on the floor with a lacrosse ball, and they're going like this, and they're, you know, they're in a lot of pain,
so agonizing. So terrible.
So here's the message. The trigger points are a nervous system phenomenon. Okay. It's a neuromuscular issue. So the idea is to not freak out your nervous system.
Right.
So if you're tightening up, even if it's just a little bit, if you're tightening up in defense, your nervous system is getting the message to tell your muscle to
contract more, right?
That's right.
Yeah.
For most people, it works better if you calm the nervous system while doing the treatment.
Yes, absolutely.
Every once in a while, you find somebody who needs slash and burn massage to get better. But in my practice, they have to earn it. They have to prove that they need it, and they have to prove that that they can take it.
Right. Yes. And from a trauma perspective, I could talk about that for a long time, because we dissociate from parts of our bodies and don't even necessarily feel. So that can make it a little tricky for our job as well. But so let's say that I do find that trigger point and I'm using the right amount of pressure, the right amount for myself in that spot, in that time. And I feel, do I have to feel the trigger point release to actually feel better? And when it releases, sometimes and often it comes back. Why does that happen?
So that's a lot right there.
I know.
So this idea of relief. So ideally, we're pinching, I'll do this side in the sun. So we're pinching the trapezius. Ideally, the tissue under my fingers here will soften. Yes. And the spot that I'm pressing on will become less and less painful, and eventually not painful at all. I might move my fingers over a little bit and find another little spot that's a little painful. That's what we call release. Tissue softens and becomes less painful. Not everybody's body does that.
Totally.
Okay. So under the right conditions, you're hydrated, you've got the right vitamins and minerals, and you're not eating foods that your body hates and are poisonous to your body, that your body is functioning biochemically, that it is well and healthy. That's helpful. Even people who have wonderful nutrition and exercise and everything don't get that magic release. There's a lot of different ways to create that release. So I have about 12 different ways that I treat a trigger point. I can press and hold it. I can do a moving stroke, which is what we talk about in the trigger point therapy workbook. You can press it and stretch it at the same time, lengthen it. You can press it and contract the muscle at the same time. Now, you have to get the exact muscle fiber. You can do that. You can press it and relax your whole body like you're melting into the floor. There's a lot of different ways to do this. Yeah. So do you have to get the release? No. And I think it's important for self-massage that you don't go for release as your goal, because you will overdo it. Yeah. I think it's better to underachieve with self-treatment. One, because if you're new to it, you don't know what you're doing yet.
Totally.
Right?
Yep. I completely agree.
Underachieve, do too little, and work your way up from there. I really like self-massage 2 to 3 times a day on the spot that hurts, on the spot that I think is the problem. So I think trapezius is the problem. I'm going to massage it, but while I'm on this spot, less than a minute. Less than a minute on this spot, because the goal is I want to increase the circulation, increase the blood flow without beating it up and bruising it, and giving the body 2 things to work on.
Right, exactly.
Increase the circulation and then get out of the way. Now, probably it's not just this spot in the trapezius, it's also this spot in the trapezius and this spot out here and this spot. And then there's the lower trapezius to think about. And then there's your crunchy posture, because you've been sitting, stuck at a computer or leaning over a massage table. So then you look for what else could be making your trapezius cranky. Like, I don't know, your rectus abdominis, your chest muscles pulling you into forward flexion. Yeah,
absolutely. Pecs, lats, and teres. Pecs, lats, and teres for all the shoulder stuff is usually where I begin. Yep. Yeah. And so, but then it comes back, why would I have to work it several times in a day? If I gave it some attention and did that right amount of pressure for under a minute, why do trigger points come back?
Well, one, so say, for example, I'm getting tension headaches and I finally, maybe I get a massage and it's better for a week. And I think, okay, I can't get back to the massage therapist. I can't spend $100 or whatever it costs every
Sure.
week for a massage. Let me see if I can do this myself. Right. So, the antidote, you've spent what, a few minutes, an hour at a massage therapist. You've spent a tiny amount of time for something that you've contracted 1,000,000 times this year. Right. So, the balance of it, it's going to take a little time to release and relax. And then your question is, why does it come back? So there's a lot of reasons. So maybe I'm working my trapezius. I get a good response. I get my headache to calm down, the back of the neck pain, the temple pain has changed. I'm feeling better. My neck moves better. I think, okay, there's some good stuff to it. If it comes back within 10 minutes, you missed it. You're not on the right trigger point. There's something feeding the monster. Okay. If it's better for half an hour, that's debatable. If you've been if you massage it, it's better for half an hour. You massage it, it's better for half an hour. You massage it tomorrow, it's better for half an hour. You're missing it. This is not the problem. It's the second or third domino in a chain of problems. Okay. So you're treating something that you're finding, it responds, not getting a response. Ask, okay, what else? What refers pain to the upper trapezius? What affects the upper trapezius? First off, lower trapezius refers pain to the upper trapezius. And then dysfunction.
Right.
I'm overstretching my lower trapezius, which you'd asked in your list of questions. The long, overstretched muscles develop trigger points. The short, tight muscles develop trigger points, but they don't cry.
Right. So, they don't cry.
So this is James Wislasky. He's an orthopedic massage instructor and author. He says the victims cry, the perpetrators don't. The victims cry, the perpetrators don't. So me and my slouchy posture, right? Because I'm massaging people, right? So rectus abdominis, I'm bent forward. Look what happens to my upper back muscles and my spinal muscles. So where am I going to feel it?
Right. In the back.
And my head. I'm not going to feel it here. But if I go and massage right here and loosen up my rectus abdominis, it changes my whole posture. I can bring my arms back and my back pain goes away from this. Right. So this would be like a mechanical postural perpetuating factor. What is feeding the monster? Why does the trigger point keep coming back? Is it long and overstretched? Does my posture look like this?
Typically, yeah.
Well, this trapezius is not going to like that. Right. It might want to strengthen. We'd also want to figure out what's pulling your shoulder down, or what's pulling your rib cage down, or your pelvis down. The why. That's what I spend most of my time doing, figuring out the why. Why do you have this problem?
Right. And then what often happens is that people who have that kind of posture, they come in and they say, oh, I get this ache here, so I'm stretching it, and I'm stretching it. And I'm like, yeah, and that's not working because you're stretching the wrong side of the equation, right? But then we get this idea, and it makes sense, right? I feel something tight in my body. So if it's tight, I want to stretch it. But often it's tight because it's long. And it's also acting up because it's long.
Right.
More taut often.
Is different than tight.
Taut is different than tight.
And so we have a treatment guidelines rule list in the trigger point therapy workbook. And rule number 9 is, which is the last on the list, is if you get no relief, you may be working the wrong spot. Okay. So in the trigger point therapy workbook, we have diagrams of where where to find the trigger point for the referred pain pattern that you're feeling. Whole list of muscles of different. There's like 11 muscles or something that send pain to the front of the shoulder. And you go down the list and you look for those. Our book is a lot like the other resources that are out there about trigger point therapy. We chase around the trigger points. We chase around the trigger points, and what we neglect is to talk about the dysfunction as much as we should. So the book that our books are based on, Travell and Simons, right? Myofascial pain and what? Dysfunction.
Dysfunction.
Dysfunction, myofascial pain and dysfunction. The why, the dysfunction it's creating, and the dysfunction that the trigger points are being created by. Mm-hmm. So it's like the world has figured out that they're like, our book and several other resources have helped to bring the concept of trigger point therapy into the mainstream. Hallelujah. My dad would be so excited.
Seriously. Yeah.
Right. Janet Travell, Dr. Travell, who was the pioneer of trigger point therapy. She would be so excited.
Mm-hmm. She would.
And there's so much more to it than chasing the referred pain patterns. It's figuring out the perpetuating factors. Why? The why behind it, and why can't we get it to release? Why can't we get it to stop coming back? And it's complicated. It's strengthening, it's stretching, it's nutrition, it's getting rid of the toxic stuff like mold, parasites, the postural dysfunction and habit. Sometimes it's as simple as my husband sits on the left of me in a recliner side by side every night while we watch TV, and I have my laptop on my lap.
Yeah.
So we get the laptop off the lap, or we build it up with some pillows and get the elbows supported, get some stretches, get some movement, get some self-massage. And then we also stop looking at husband to the left.
Right.
Like we could change places with the husband. So those habits, those little tiny habitual things that we're doing add up.
Right, because it's that habitual tendency to contract certain parts of the muscle that can lead to trigger points, right? And so the muscle gets, the kind of nervous system kind of gets stuck in this habit, and then it lays down those trigger points. Yeah.
Muscles learn.
They do. Yeah. Muscle memory. Yeah.
Yep.
And so let me just see. So let's talk about stretching then. If I am stretching and doing yoga and I feel worse afterwards, why is that? What's happening to the trigger points in my body?
Well, you could be a muscle with trigger points does not fully stretch, and different bodies do different things. So if you are a person who's always stretched after exercise, you've always done yoga, stretching is something that is worked for you. In my clinical experience, you're more likely to respond to stretching as therapy. For somebody like my dad, if you read the Trigger Point Therapy Workbook, the first edition, especially, second edition is a little bit better. My dad was very anti-stretching because he didn't stretch and his muscles didn't stretch. And every time he tried to stretch out a muscle with trigger points, it had a bad result. There's a continuum. So there's a spectrum, right? If you don't stretch and stretching doesn't feel good to you, stretching as therapy, even with a well-intentioned, very well-educated, super great physical therapist, may not work for you. So you address the trigger points, you soften the whole muscle, you treat the fascia, and then lengthen and stretch and see if that helps. That's one kind of approach. Soften the muscle, the fascia, the trigger point, and lengthen it and see if that helps, see if that changes it. If it doesn't, you have to look deeper. Then what's making this muscle so cranky? Is it overstretched already?
Right. Right. That's that opposite side of the equation that we were talking about, right? It might be the one that's pulled too long, that's taut. And so that's why it's holding trigger points, because it's kind of pulling you back. It's kind of trying to pull you back.
That's right. That's right. And that's the part where you need somebody else's eyes, oftentimes, to do an assessment of your range of motion, of your posture. Self-applied massage, I'm a huge fan. If I never massaged anybody ever again or treated anybody, I would still do self-applied massage on myself all the time.
Yeah.
I think everybody should be doing it, right? Here it is.
Totally.
We brush our own teeth. We do not go to the dental hygienist once a week for them to brush our teeth, right? Nobody can afford that. And nobody has time for that. And yuck,
Right.
So every day we get the gunk off our teeth and we have fresh breath. We do a little bit every day and you do a pretty good job. It helps, right? It makes a big difference. You don't have to be perfect at brushing your teeth. You don't have to be perfect at massaging your own trigger points. Mm-hmm. And just like with the dentist, every once in a while, you're like, I have a bigger issue, or I need a deeper cleaning, or something else is going on, and you need somebody else with more experience to take a look at it for you. Same thing mm-hmm. with a massage therapist, ideally somebody who's got some advanced training in problem-solving massage. That might be called trigger point therapy, myofascial trigger point therapy, manual trigger point therapy, or orthopedic massage therapy, neuromuscular mm-hmm. therapy, musculoskeletal massage therapy, myofascial release, somebody who's got Rolfing, structural integration, the list goes on. There's
right.
a lot of different dogma,
right.
Same ideas, some
right.
variation.
Address the imbalance. Ultimately, address the imbalance.
Advanced yep. training and problem-solving massage.
Yeah. So just a couple more things. Do trigger points always cause pain? Can you speak about the latent and active trigger points?
Mm-hmm. In my PowerPoint presentation, I've got this really cute slide of kittens, right? And I think it really works. We all have latent trigger points, latent just sitting there sleeping, the sleeping kitten, right? Mm-hmm. And if a massage therapist, or if you do, if you press around, you massage, you find places that are tender and you go, oh, I didn't even know it was tender there. Amber, you mm-hmm. find tender places I didn't even know existed.
Right.
Yeah. Those are latent trigger points. They're just sitting around waiting for you to go wrong. Mm-hmm. It's also the stuff where, you moved your house from one place to another, right? So you lifted 100 boxes, and then, mm-hmm. like the next day, the front of your elbows are yeah. sore, and mm-hmm. your shoulders are sore because your biceps. And 2 or 3 days later, that's gone, right? But if you come in here, I will look for trigger points in the middle of your biceps, because mm-hmm. now they've gone latent. Mm-hmm. And they're just going to, be quiet until you overdo it again. Trigger points shorten the muscle. Trigger points make us old.
Yeah.
Okay. They shorten the muscles. They shorten the joint. They shorten our range of motion. They shorten mm-hmm. our stride, because mm-hmm. we learn. Our brain goes, oh, that hurts. I'm not going to move it as far. Right. But we forget when the pain is gone. We don't realize it. And so we forget to regain that range of motion, which is where yoga, mm-hmm. physical therapy, exercise can be so helpful.
Mm-hmm. And I think that, well, I think that trigger points are really contributing to arthritis conditions, just like because there's an imbalance pull on the joint, where the muscle is, if my bicep is pulling kind of wonky on that elbow, or if my rectus femoris quad is pulling wonky on the knee, then we get that limitation, and then there's less movement in the joint. So then there's more toxicity that kind of gathers in that joint, and it just can lead to a host of problems, but I think also contributing to arthritic conditions, because the joint just can't stay as clean, right? It doesn't get,
because it's not moving.
Right.
And also where the tendon comes in and attaches to the bone, it's going to lay down more calcium and create like bone spurs from the tension, because the bone is trying to meet the soft tissue. Mm-hmm. Mm-hmm. Remember, the tendon is what the muscle becomes tendon and attaches to the bone. So tendon attaches muscle to bone, and ligament attaches bone to bone. Mm-hmm. So if you have problems in a tendon, you have tendinitis, tendinosis, lateral epicondylitis, all of those tendon issues, treat the muscle, the whole muscle. Look for the trigger points in the muscle, as well as addressing the tendon itself with your physical therapy.
Yeah, absolutely. Absolutely. Okay. Yeah, I forgot the second part of that question too, so we'll just forget about it. And is there anything else that you would like to share to help people to feel empowered to work on their own bodies? Because in some ways it sounds complicated, right? And it can be complicated, but it also can be simple. So is there anything else that you would like to share?
One, you're going to live with this body for the rest of your life. Okay. Mm-hmm. So you have an opportunity. You have an opportunity to try something, Try it and see if it helps. You might be surprised. It's better to do too little and then repeat it and work your way up, especially if you're worried about hurting yourself, or if you're worried about making it worse. Just do a little bit. You're going to live here tomorrow, you know, in the same body. Try it again tomorrow. Work your way up into a more and into, you know, a moderate level of treatment, moderate level of pressure. What works for your body? You're going to listen to your own body first of all. And it's trigger point therapy. Self massage is not hard. It's not complicated. When you get into trying to figure out the dysfunction, that gets a little bit more complicated and needs, you know, oftentimes another set of eyes. It can be your husband's eyes. Like, why do you think my back hurts?
Right.
And he might go, well, sweetie, your posture could be better, you know, and some of those changes. What else do I think people need to know about trigger point therapy? I think you need a resource. I think that the internet is it's got a lot of great stuff now, with even just specifically with trigger points. There's a lot of great videos. Mary Biancalana has got a lot of great videos with the Chicago Center for Pain Relief, I think is what it is. You can look up Mary Biancalana. She's got a lot of great videos out there. Richard Fenn has got some good videos. Lots of folks.
I have a YouTube channel on self trigger point release also.
I didn't know that. So that's so exciting.
Yeah.
I'll look it up. But I think you also need a book or a website that has got more information than a diagram with the trigger point and the referred pain pattern. Our book, I think, is the most comprehensive version of that I'm aware of, because it has prose, it has whole paragraphs about the muscle, about the symptoms, about how to find the trigger point, which I think location and palpation is the hardest thing, because you can be in the right area. And my book is going to tell you, it's going to say, okay, so when you're trying to find the upper trapezius, you can raise your shoulder, you're going to follow your collarbone out. And then as you start to go uphill, that's the trapezius. So you're going to reach your fingers around back, and you can pinch and grab and roll that. You want to have short fingernails. And then I'll tell you, like, all right, so this trigger point number 1 in this illustration is a little tiny baby pinch. It's like this last little roll, like a size of a pencil on somebody's body that looks like mine. A big muscly man, he doesn't have a pencil size roll here. It looks more like a marker, but you just get that last little bit and you feel like you're just getting skin, but that's trigger point number 1. So find a resource. Our book is cheap. It's all over the internet in illegal versions. I make a whole $1 every time you buy a book. So it's not like, you know, I'm making $1 million here. Go to your library, find resources that explain how to find and how to treat and what the symptoms are and what to do if you go wrong. If you go wrong, ice it. Okay. If you make it worse, ice it and calm down. It's not going to last forever. You didn't break your body. You didn't ruin your body. It's going to be okay. The most important thing you can do is calm your nervous system.
Exactly. Yes, exactly. Great. All things I tell people. So wonderful. Good. Great. So Amber, thank you so much for your extraordinary knowledge and sharing your expertise today. I'm really grateful. And people, again, can find you at New Day Myopain Clinic in Louisville, Kentucky. And
my website, newdaymyopain.com, newdaymyopain.com. I have a really dumb website with triggerpointbook.com, which is just a 1-page with the book, because I'm a much better clinician than I am a bookseller.
Well, everyone should own this book. Absolutely. I 100% agree. Everyone should own it. Yeah. So thank you again. I hope you have a wonderful rest of your day, and I hope to see you again soon.
Yeah. I can't wait to look up your videos and your website.
Great. Thank you. I'll send you a link.
Okay.